Cassie, thanks for being with us today as we take a closer look at COVID-19, what information people need to know, what the latest updates are. When we look at testing in South Dakota, where are we right now in terms of who needs to be tested? What are those guidelines that you and other health experts are following to say, yes, you need to go get tested?
Well, thank you for having me, Stephanie. I really appreciate the time to talk a little bit about what's happening in South Dakota. We follow CDC guidance for our testing, of course, and individuals who have mild symptoms may not need to be tested if they're able to recover at home. And in fact, if they're able to recover at home, that limits their exposure to others and potentially getting them infected. So that would be the recommendation for those individuals. The people that are experiencing more severe symptoms, such as shortness of breath, fever, fatigue, cough, those individuals we would recommend calling their healthcare provider, being evaluated, and determining a plan of care with that provider. And that could include testing as well as ruling out other alternative diagnosis. We continually see changes from CDC. There are symptoms that are added occasionally. You may have noticed that nausea, vomiting, and diarrhea were recently added from the CDC as symptoms that could align with COVID, as well as some of the testing recommendations for certain populations. So you may have seen recently that our long-term care facilities are being tested, and that is through coordination with our health partners and our Office of Licensure and Certification, as well as many of the people that we have in the Department of Health to support those efforts with our partners.
What about how long it takes to get the results back? Typically, how long is that?
So I can't necessarily speak for the health systems or commercial labs, but the South Dakota Public Health Lab has been getting test results back within typically 40 or 24 hours. And that is fairly typical of them, but I want also to say that that is the turnaround time to get that result to the healthcare provider. Now, that healthcare provider then is responsible for notifying that person if they were positive. At that point, we then initiate that investigation and make contact with that person.
What are some of those things that you're looking for from those individuals?
Typically, when we make contact with that person, our first route of communication is through a phone call. Now, we recognize that some people may not have phones, that we may not have the most up-to-date information. So we also have other tools and resources that we use to ensure that we are getting a hold of that person. And in fact, we even occasionally will go to a home of their last known address and try to visit with the person that way. Once we're able to talk with that person, we go through their symptoms. We assess how they're feeling. We ensure that they have the ability to isolate at home. And if they don't, we try to figure out services that would be able to help them isolate elsewhere away from their family or other people that may be living in the home. We identify what their symptoms are. And in fact, we go 2 days before the symptom onset or when they first start experiencing those symptoms, and we identify who their contacts were. So those could be social contacts, it could be household contacts, work contacts, and then we identify if they have any contact information. We gather as much information as we can to be able to make contact with that person they were in contact with. And you may have noticed too, in some instances, there are public notices that go out, and that's really used to, in situations where there is no way for us to be able to determine who may have been in contact with that person, or they were in a social setting and we just don't know who was in that location from 8 a.m. to 10 p.m. or whatever it may be.
So what extent do you go to communicate with those people that have been exposed?
We communicate with that person the same route that we would with a positive person. So we attempt with a phone call and use other resources if we're not able to get a hold of them through phone call. We then instruct that person to self-quarantine for 14 days and watch for symptoms. When we talk to that person, we also enroll them if they have the capability for text illness monitoring. If that person then during that text illness monitoring indicates that they have a symptom or are symptomatic, we would then give that person a phone call. We would talk through those symptoms with them. We would determine if they need to go see a healthcare provider or be tested. And I should go back to the individuals who are positive. We, of course, also recommend for those individuals to be isolated, and that's a period of at least 10 days and also 72 hours fever-free without the use of fever-reducing medications.
I want to go back to that 10 days because we, for so long, have been hearing 14 days, 14 days. What's the difference between the 10-day time period and the 14-day time period?
So as we continue to learn more about COVID-19, we continue to learn when the infectious period is for that person and when they were exposed, how long to go back before they were exposed where they might have been infectious. So the difference in the days is simply that. For someone who was a close contact, we go back 2 days prior to when that positive person started experiencing symptoms because they could have been infectious those 2 days prior to that time and could have exposed someone during that period. Now, for the close contacts in that 14-day period, it's the same thing. As we continue to learn more, we identify that from the time that person was exposed, it's around 14 days where they would probably or likely show symptoms.
When it comes to the guidelines from the CDC, where are we on mask wearing?
The current recommendation for masking is for those individuals who are not able to maintain social distancing. So being within 6 foot or remaining 6 foot apart, or being in those settings where there's a lot of people and you're not able to maintain that social distancing, it is recommended to wear a mask. Now, the type of mask typically is the cloth mask that they recommend because we want to make sure that we're saving those N95s and surgical masks for our healthcare workers who are on the front lines dealing with positive COVID patients.
What have been some of the bigger changes that you've seen that you think it's important that people understand?
We in South Dakota have taken great measures to ensure safety. We have our healthcare partners who have ensured that if someone is coming into the clinic or the hospital, they've taken different measures to ensure that people that are coming into the clinic are safe and limiting exposure. One of the things that is coming to light more recently is some of the things that we need to start focusing again on, and that includes vaccinations and well child visits. I know people are still concerned about going into clinics and exposures, but we really want to make sure that people understand that health systems have had some time to put parameters in place to ensure safety. And we want to make sure we're getting back to some of those needed visits.
Thank you, Cassie Deffenbaugh with the South Dakota Department of Health, our Disease Prevention Service Administrator. We thank you for your time and the information you provided. Thank you.
Thank you for having me.